just all kinds of things that lower our testosterone. And these young guys are having to figure out how to deal with it, and nobody's really advocating for them. Nobody's really trying to help them feel more stable. And I think a lot of problems with young men these days is hormone.
Hi, everyone. Welcome back to another episode of Nourished Inside Out. Today, we have the pleasure to speak with Dr. Michael Morse. He is a naturopathic doctor located in Phoenix, Arizona, and he specializes in men's health and fertility and environmental medicine. He is also a professor in men's health at Sonoran University. Thank you for joining us today, Dr. Michael.
Thank you for having me. It's wonderful to be here.
Do you mind telling us a little bit about your journey in naturopathic medicine and what inspired you to focus on men's hormonal health?
Yeah, so I started my journey with naturopathic medicine probably, well, I actually always wanted to be a doctor. So as early as probably 8th grade, maybe or early high school, I was already starting to focus on, how can I get myself into a pre-med program and get into med school. I was also a musician, so I was playing saxophone and doing saxophone in college as well. And so there was kind of this push and pull between, well, should I do music? Should I do medicine? So I decided to do both in the end, just so that I could keep up my saxophone playing. But at a certain point in college, I got a little bit, I don't know how else to say, but maybe a little disgusted with the modern medicine model of just kind of pill pushing. And just a little bit of my own background. I was seeing my family physician who I'd seen for years as a kid and into adulthood. And I was having some heartburn issues and some long-term issues that he could tell in my throat that I was having heartburn almost every night. And his answer was to just give me some pills. I don't really remember what they are, but in hindsight, they were probably like omeprazole or something. It's a proton pump inhibitor that you just take daily forever. And they were these sample packs, and he just gave me a bunch of them. He's like, here, try these. And even at that age, I was probably like 18, 19. I thought that that was a little bit um, maybe lazy. He didn't really ask me any questions like, what are you doing? What are you eating? We did have a brief conversation. Maybe you shouldn't eat so late at night. So then you get, reflux when you're laying down. But that was it. There was no discussion on diet. There was no discussion on history of what, I might be eating that led to this. And so I was kind of turned off, and that kind of really kind of derailed my journey into trying to get into a traditional medical school and do all the things. So I kind of just leaned on music for a while and graduated with a music degree. And I didn't even know about naturopathic medicine until, I want to say, maybe 2 years after graduation, maybe a year. And I had just found it online that there was this breed of doctors that actually look at the whole person, and they do a full diet and lifestyle analysis. And I was in Texas at the time where I went to college, and they had this pharmacy there that was a compounding pharmacy that had naturopaths that were licensed from other states actually working there and doing, naturopathic medicine. I think I found them from a radio ad, which was really interesting. So that got me in there, and I got to meet, actually, she's now my mentor, would become my mentor. So the first naturopath I ever met, and I started seeing her and really discovering what they do. And I was just so impressed. I was so floored that there's this type of doctor out there that actually listens to you, like gives you a full hour to talk about everything that's going on with you, where most of us are used to experiencing doctors in a span of 5, 10 minutes, right? So I was immediately hooked. And so I started digging and trying to figure out what I could do to get into school and go that route, because I was just immediately impassioned to just figure this out. However, since I graduated with a music degree and gave up the pre-med track, I still had a few prereqs to do. So I took 2 more years doing some post-baccalaureate classes and getting everything I could set up to be able to go to school. I ended up choosing the school over here in Tempe, Arizona, which is now called Sonoran University, used to be called SCNM, Southwest College of Naturopathic Medicine. And the rest is history. I got in and started going there and just was immediately just in love with the whole place on my interview day. And so that's kind of how I got into naturopathic medicine.
I think that's incredible. I love how you took that leap of faith and you went from a music degree and went back down the pre-med route because it was something that you said you initially wanted, but then you kind of changed your mind and changed routes a little bit and got a degree in music. But then, your paths just crossed again with the naturopathic medicine. And I think it's incredible how for you to stay determined and to go back onto the track that you originally wanted.
Yeah. Yeah, it was a little bit of a roundabout journey, but I'm glad I got to still become a doctor, and it's the kind of doctor that I didn't know I wanted to be back in high school. I mean, nobody goes to med school thinking, "Oh, I'm just gonna be a pharmaceutical shill and, try to push all these drugs." They wanna change the world and they wanna change their patients and make them better, but and I mean, we could go on a whole tangent about the current medical system and its problems with insurance and all that, but naturopaths enjoy a little bit of freedom in that regard because we're not brought into the fold. We're not accepted by mainstream medicine. And that comes with problems, but it also comes with a lot of benefits too. Namely, we don't have to do what they have to do. If I was an MD and I was a regular doctor and I had to go out there and practice, my two options are I take insurance, any insurance that'll accept me or credential me. And then I got to play ball. I got to play by the rules. Or I can do a cash-based practice, but then I gotta do all the marketing myself. When a doctor signs up for all these health insurance companies, that's their marketing. They don't have to worry about trying to go out and get patients. Patients come to them because that's just who their insurance is. But whether you're a naturopath, whether you're a functional medicine MD, which is a different kind of breed as far as natural doctors go, they are out there. They struggle too, like we do, as far as how do we get patients? How do we get known because we don't take insurance? And so that's kind of a struggle. But we don't have to follow the same guidelines that they do. We don't have to follow the same short visit structure that they do. We get to have a lot of time with our patients and actually get some good results because of it.
Wow. That's incredible. Thank you for sharing that information about it. So I know you said you mainly specialize in like men's hormonal health. I feel a lot of
Mhm.
times it's something that's discussed on the women's health side. Why do you feel like men's hormonal health is more overlooked and why is it important to address?
So that is kind of a hot button issue in medicine. And a lot of the reason I got into it was because, well, if you look at the numbers for my medical school, my graduating class, it's 3 to 1, 75% women, 25% men who graduate from naturopathic schools. And regular medical schools are kind of trending in that direction as well. I think it's more than 50% women at this point, which is great. But in doing so, we talk a lot about hormonal health in medical school, in naturopathic medical school. And of course, a lot of it focuses on women because women's hormones it's complicated and it's on a cyclical nature. It can really impact their health. Men's hormones are much simpler. There's much less interplay between, monthly cycles or something like that for men. But it still is important because if a man is having struggles in that area, it can drastically impact his life and his mental health. So there is a lot of issues that are overlooked there. But I would say that, a lot of it is kind of a stigma too, because we're talking about testosterone and we're talking about a controlled substance. Testosterone is a Schedule 3 controlled substance, which means it has abuse potential. When we talk about women's hormones, there's no abuse potential there. It's not like a woman is going to get hooked on estrogen or progesterone. Progesterone can be nice, especially if you have insomnia and you're finally sleeping on it. But it's not like you go and take some progesterone and feel almost like life or death if you need to get off of it. Like for some guys on testosterone, especially if you are a guy who started testosterone in the midst of an anxiety disorder and got better on the testosterone. Can you imagine wanting to stop or having to stop testosterone and having to face those demons again if you were to stop? So it's pretty profound in the way it can impact a man's mind. Ironically, you think of like a guy on testosterone, your mental image of that might be somebody who's like, toxic masculinity, roided out or something like that. But that's not really how it actually works. And there's actually a lot of different androgens out there that people can abuse. And so that can be mixed up with what an actual healthy level of testosterone looks like for a guy. And then there's all the social issues too. There's men are much more likely to commit suicide, for example. There's a lot of issues that young men are facing these days that I think even the older population just doesn't even understand right now, especially the older physician population. All kinds of social issues like, oh gosh, there's just so many. Porn usage is rampant. Microplastics. Then we're getting into environmental medicine here. Just all kinds of things that lower our testosterone. And these young guys are having to figure out how to deal with it, and nobody's really advocating for them. Nobody's really trying to help them feel more stable. And I think a lot of problems with young men these days is could be hormonally placed. Because when I get a guy on testosterone and I get him feeling better, usually he's just more grounded. He's more stable. He's not as unpredictable. He doesn't have as many mood swings. He feels more confident in the world. He feels more confident in himself. And I think if a larger percentage of guys were walking around feeling like that, I don't think we'd have as many of the problems we do with young guys, feeling a little crazy, to put it for lack of a better word.
That's totally valid. I thank you for explaining that because I think a lot of times it is overlooked and it's not talked about enough. Can you
Yeah.
tell us what some early signs of hormonal imbalances are in men that they often ignore?
Yeah. So, and again, in young guys, it's not as common to get super low. Usually, when I have a guy come, I'd say the most common age for a guy to come to my clinic is probably in his early to mid 30s. And that highly depends on when they've had children too, and kind of get into that part of it later. But I'd say the most common signs and symptoms are insomnia. He's not sleeping well. He's not, probably the most common would be fatigue. He's just noticed a sudden fatigue over the last few months. If he's a gym if he's a gym person, he maybe is not really gaining any muscle anymore. It's just kind of going and nothing's happening, which can be frustrating, especially if you're really showing up. I mean, some guys go 3, 4, 5, 6 days a week, and then they just kind of stop. They're not stop going, but they stop changing. Their body stops changing, um, or they're not able to push as hard as they'd like. Um, and then there's other things, more subtle things like maybe they're more anxious than they used to be. They're just a little more nervous, little less confident walking around in the world. And that's a really fundamental feeling, especially for a guy. Um, we find that guys who, and it's hard to suss out what came first, but guys who travel, their testosterone goes up. Uh, but we don't know if that's guys who have higher testosterone baselines are more likely to travel. But it's something as fundamental as that. It's just being out in the world.
How does stress play a role into it? Do you see stress affecting it more so than others?
So that's another chicken and egg issue because stress will lower testosterone, but lower testosterone may lead to more stress. Because when you're stressed, you're going to release more cortisol, and that's going to inhibit more sex hormone production. And so automatically you're going to have lower testosterone. Cortisol just wreaks havoc on all aspects of the body. But when a guy is stressed, he's probably going to first notice that his morning erections go away, which is a really strong indicator of a robust testosterone system. And so when that happens, he could probably already tell you he's not sleeping well. He's been stressed about work or something like that, and it's just mounting, all the social pressures. And so sometimes we give a guy testosterone like that, and he's able to climb back out of that. And then sometimes we have to work on stress techniques instead to get him feeling better first. Um, and circling back a little bit to the stigma that I was mentioning, when a guy tries to go to his regular doctor, his MD, and asks to get his testosterone tested, there's already resistance there. Even just asking to test for your testosterone, depending on who the doctor is and how they feel about it, they might try to refer you to a urologist. They might order it for you, but then getting on it is a whole nother issue. And I'm not sure why doctors are so afraid to put guys on testosterone. I guess that would probably be that interplay with insurance and their boards. They're afraid of getting in trouble. But a lot of evidence now points to testosterone actually being a good thing. Getting it to a normal, healthy level is actually protective of the heart, protective of the liver, and just makes men more productive in general. So I wish things were a little bit different, and things are slowly changing. But for many, many years, testosterone therapy has been stigmatized, and doctors have been afraid of it. And some of the older doctors who've been in practice for a while still have it in their head that testosterone equals heart attacks, testosterone equals prostate issues, and all that stuff. Testosterone equals drug seeking. No, but that's definitely not the case from the many patients that I've treated. We've treated at the clinic that I work at. We've treated thousands of patients, maybe even tens of thousands at this point. And I don't think I could point to a single case of prostate cancer or heart attack that has been linked to the treatment that we were providing.
So would you say those are a lot of myths that a lot of like doctors or MDs they have around testosterone?
Well, I don't want to say myths because when testosterone is abused, it can lead to those things.
Okay.
So, but we carefully monitor. We do lab testing every 3 months, so we're looking very closely. And that's the other issue too, is that men often don't go to the doctor for issues, and this can be part of it. They're not really listened to, and I know women have the same problem for certain female issues as well. But when a guy goes to the doctor and he's complaining of these issues, and testosterone can fix it like in a week. They get disenfranchised, and or maybe it's a guy that just really never would go to the doctor. We have a few that just have never been to the doctor in their life, and they're coming to see us for the first time, or maybe they haven't been since they were a child. They're coming to see us. That's our opportunity to, and maybe they are just seeking testosterone. Maybe they're a bodybuilder or something like that. We get these guys into the clinic and we're seeing them every 3 months, which is way more than they would see anyone else. They might see their annual, their doctor for their annual physical once a year. But we're able to take a microscope to these guys and actually monitor their health. And we do, a whole body assessment. So we're looking at all kinds of different things and lab testing for things. We're able to catch people's cancers early. We saved a guy recently who had renal cell cancer, which would have totally killed him had we not caught it. And he just got a cut out of his kidney. He was endlessly grateful for that. And we saved his life. And so, for someone to come over to us and say, well, testosterone, you're just a testosterone mill. Well, that's not really true. We're really helping people here that maybe wouldn't have gone to the doctor otherwise.
Yeah, you're really changing lives because it's more taking kind of like, would you consider it a holistic route? And also,
Yeah.
how often would you recommend your patients to come to you?
So we have them come every 3 months. If they've been really stable on it for a long time and they're a good patient, they're compliant, they're healthy in all the other areas of their health, um, then they can come every 6 months to maybe even a year. But generally it's every 3 months. And in some cases we're lab testing every 3 months too, which is a lot. But when you're on testosterone, there are certain parameters you have to look at very closely. One is you can make too many red blood cells, so then your blood gets a little too thick, so it can lead to high blood pressure and a possible risk of blood clotting. So we're monitoring for that, and we're also looking at kidney and liver function, make sure that's stable over time, and then we're looking at the prostate through the PSA marker, which is like a measure of something the prostate releases when it's kind of metabolically active or even damaged in some cases.
Amazing. I know you were saying that you also specialize in men's fertility and environmental medicine. Do you want to
Mhm.
go a little bit into that and why it's important as well?
Yeah, so those were actually the precursors to me working in men's health. When I was in medical school, I actually was really fully into environmental medicine and, making sure that we could help the population with all these toxicants we're exposed to. I say toxicants because those are the man-made chemicals versus toxins, which are more of something that a plant produces as a defense mechanism. But so I was actually president of the Environmental Medicine Club, and I've also been chair of various other environmental organizations. And so that ultimately is my passion, and I kind of bring that into a lot of my patient visits with the guys and women that I see because we're all exposed to that kind of stuff. And so, and that kind of plays into fertility because the most vulnerable population is our youngest, and I'm talking even down to day 0 and before. So if I have a couple that comes to see me and they mention that they're thinking about having kids, my first thought is, okay, how can we get you cleaned up as much as possible? I would have probably specialized in environmental and as it relates to fertility exclusively, but I mean, I had to be real with myself and remember that most people don't really plan that far in advance to get pregnant. And some do. Some are working on it, and some have some major success stories on detoxing these issues where they were infertile before or subfertile before, and then getting these like microplastics and endocrine disruptors out of their bodies allowed both parties to be more fertile, and then they were able to get pregnant. So that's probably my favorite part of my job is helping couples like that. But again, a lot of people maybe don't plan that far in advance. Um, and if they're following with their insurance through an OB and they are struggling with fertility, they're just shunted right into the IVF route. Fertility is huge. And Men really are 50% of the equation, and there's lots of ways to make a man more fertile. We often do semen analysis tests just to see where they're at, but they're not always the most useful. You might have a man that's got a little bit more sparse sperm, but if he's with the right partner and she's fertile and everything works fine, then a guy may be fine. And on the other side of it, a guy may have plenty of sperm, but they might be morphologically just kind of odd and not swim very well, for example. So it can go many different ways. And I find that just really getting a lot of um, his lifestyle, his diet under control is a great start in getting him more fertile. And then, of course, working on the woman as well at the same time.
What do you recommend for couples to do to start, like, cleaning up? Like, what is it with diet? Is it with products that they use, like using non-toxic products, eating
Mhm.
more clean? What are some things that you recommend?
Yeah. So if a couple came to me and they mentioned that they were thinking about conceiving the next couple of years, I would probably counsel them on some very basic things, and a lot of that would center around we need to avoid plastics as much as possible, particularly BPA, which BPA is in all kinds of things, even receipts. So and these poor cashiers are touching these receipts all the time. You don't know what receipts are. I think they're called like heat activated or something. You don't tend to know which ones they are. So it's best to just let them plop it in the bag for you. There were some studies where they showed how much BPA got in your blood just from like a second of touching the receipt, because the BPA exists like a powder on that heat activated receipt. And so you can get a huge dose just right there from that. So that's a big one, an easy one to avoid. And then, of course, avoiding BPA products. Like another thing that I can't stand is the Keurigs, the K cups. You've got a fully BPA plastic cup containing your acidic hot liquid. There's no way you're not getting a huge dose of BPA from that. We do know that BPA does leach from heat and it leaches from acidic conditions. And so you're getting both of that together in just like a K cup or every morning. And so it's just awful. So I would have them stop that if they're using K cups. And another big area would be phthalates. That would be something like your shower liner. If you have like a regular polyvinyl chloride shower liner, those can be coated in phthalates, which is another potent endocrine disruptor. And these are both they act on estrogen. So they replace estrogen at the receptor, and then they can cause all kinds of issues with cells, like in eggs and releasing the eggs and all that. And another one would be fragrances. And this one's huge. Anything that says fragrance on the label or smells very strongly and stays around for a long time, that's loaded with phthalates. Phthalates are used to soften hard plastics. So that's how you get that shower liner softness. But they also are used in fragrances to make them stick around longer and stay in the environment longer and be active longer. So anything that says fragrance on the label is a no-go for someone wanting to try to conceive in the near future. These chemicals are also super important once baby's around too. Phthalates in particular severely affect young boys. It can go straight to the testicles and affect testosterone production at key moments, which can lead to issues for fertility for them in the future. So it has a lot of long-standing effects that I think we're still just beginning to understand. If I could wave a wand, I would take them completely out of the system, and I can only imagine the changes we'd see in the society.
Wow, I had no idea,
Yeah.
like, how common BPAs are to begin with. I feel like I'm a big water bottle person, so, like, I love to go get a new water bottle, and it's like you find the ones that say BPA free, but I would never think of something as simple as a receipt from the store. It's just so it blows my mind. It really does. When you say things like, if it says fragrance on it, that's a no-go. What would you recommend as an alternative?
So essential oils are great. Anything that's going to say fragrance just on the label fragrance, that's a clue that it does have phthalates. But if it's got other things on there, like essential oil names, they look like Latin plant names, those are going to generally be fine. You'll notice, though, the extreme difference in how long the smell lasts on something like a natural product versus a synthesized one with the phthalates. It's a huge difference, and it's a lot of cosmetics products too. Shampoos, conditioners, soaps, even antibacterial soaps are another endocrine disruptor. Actually, the triclosan that used to be really popular in hand soaps is very closely related to BPA. It's actually another bisphenol, but it happens to be antibacterial, horrible for endocrine disruption, and we don't need to use antibacterial on our skin because then it can lead to super infections, and that's a whole other issue.
Really? Even the antibacterial soaps.
Yeah, I wouldn't use antibacterial soaps. Yeah.
Some brands make, like, unscented ones. What's your opinions on those? Do you
Yeah, unscented soaps are fine, and there are soaps out there that smell good, and they're totally usable, and they don't say fragrance on the label, and they smell good. Whole Foods probably has a bunch of them. They're loaded with essential oils, and they smell great, but I wouldn't use ones that say fragrance on them. I have seen ones at Whole Foods that say fragrance, and then, of course, I'm disappointed in them, but, their business, they're not really worried about health. They're worried about their bottom line. So that's the tough part, right? Because if you're a producer of something that's supposed to smell good, and you've got this product that would make your scent last 10 times longer and be 5 times stronger, you're going to use that. You don't really care if that causes some sort of thyroid issue in somebody or 5 years from now. You're not worried about that. You're not in the business of health. You're in the business of making people's skin smell good or their houses smell good. That's
Yeah.
all you're worried about. So it's up to the consumer to be a diligent learner of these things to make sure that they're themselves and their family are as healthy as can be.
That's so true. Because I know sometimes if I use soaps, like a bar of soap that has fragrance on it, after I use it, my skin feels more irritated, so that makes total sense.
Oh yeah.
Wow.
Yeah, maybe time to switch to a different one.
Yep.
Yeah, I try to use just really natural, just real base. I really like black soap because usually it has a lot of carbon in it. So that's a good like deodorizer basically. So any kind of black soaps are really good. They actually do char them in the process. So you get some of that carbon in the soap, which captures a lot of different stuff, a lot of different odors and different dirt and stuff. And those tend to be a lot more natural and easy on the skin. You can even use them for a shampoo. They're very versatile. You can use them to shave as well. Very safe and natural soap. Of course, they can be indoctrinated with all kinds of other stuff, but most of the time they're pretty good.
Amazing. Thank you for sharing that. So, going
hmm
back to the men's hormonal health, are there any foods that you would recommend for men to intake more of or avoid of when being more mindful of their hormonal health?
well, I'd probably say the lower hanging fruit is what we can take out of their current diet. Of course, all the normal culprits like fried foods. Unfortunately, a lot of guys come to us that are kind of heavy drinkers, so we do address that. And then, of course, sugar would be a major thing. In fact, sugar can directly lower testosterone in the hours afterwards. So we want to avoid high sugar or simple carbohydrates. And then as far as getting more, foods with higher zinc levels can raise testosterone. So you hear that, like oysters are common aphrodisiac. They actually are high in zinc. So that can be related to that. Interestingly, with male ejaculate, it contains a lot of zinc. So we're actually expelling nutrients when a man ejaculates. So you do have to replenish those. And if they're depleted, you're going to suffer with your libido, with your testosterone levels, and all that. So we do have to replenish those nutrients. Zinc is probably the top one, among others like magnesium and potassium and all that.
Wow, incredible. How
Mhm.
does sleep play a role into the hormonal health and balancing it out?
Yeah, that's a great question. So sleep is actually where our body gets our sex hormones set up for the next day. There's a complex interplay in both men and women, but mostly men as far as FSH and LH goes, because men produce those as well in the pituitary gland in the brain. Women, they're named for women's hormones because it's follicle stimulating hormone, FSH, which is what's produced at ovulation and stimulates the release of the egg. But in a man, FSH and LH are responsible for stimulating the testicles to make more sperm and more testosterone. And we actually have medications that we can use that can raise a man's testosterone and sperm production without having to do like testosterone injections, the traditional injections. And so what we do typically, if we're going to give someone like that, we tell them to take it at night or in the morning because our testosterone production slowly starts to ramp up probably around 9 or 10 p.m. and then gets more higher as we sleep and then probably peaks around 9 or 10 in the morning. That's why most men get that erection early morning, like 4 or 5 a.m. or when they're waking up, which is really a sign of good health. So if a man has a robust morning erection, that's a good thing. That means their testosterone is good for the day. They're ready to go. And so then it starts to kind of go off a little bit around noon or so. And then a man's testosterone is generally the lowest around between 2 and 5 before starting to ramp back up as the evening comes back. So very cyclical in nature as well, but it's definitely a diurnal rhythm or a day-to-day rhythm versus a woman's monthly rhythm. So sleep is paramount. And a guy will notice generally if he's not sleeping well, like I mentioned before, those erections are going to go away in the morning. And then that's usually a sign of, okay, I need to do something.
It's amazing how sleep can play such an important role in your overall health and how you function from day to day. What are some things that you wish more men were aware of when it comes to their hormonal health and their fertility?
That's a great question. As it relates to their hormonal health, I'd probably say, yeah, sleep and diet affect it more than you know. Because if you're not eating well, you're not going to be producing testosterone. You're not going to be producing good quality sperm, especially if you're trying. Studies are showing that sperm quality is a huge determinant in the health of the child. Also, dad's age is a big factor in the health of the child as well. Men accumulate mutations in their testicles at a higher rate than women get mutations in their eggs. So it's actually okay if a woman's older and has a baby as far as, the health of the child generally, pregnancy complications aside, but and I mean genetically speaking, compared to if it's a man's older sperm. So if you have a 60-year-old father or something, there's a much higher chance of autism because of his sperm versus a 40-year-old mom, for example. So if I were to I guess it depends on the age group if I was going to give different advice to different guys. So in the younger age group, I'd say take care of your testicles. Don't let them get too hot. They're very sensitive to oxidative stress and heat. Those can make mutations accumulate more, which is a big thing here in Arizona where it gets very hot. And make sure you have a good diet full of organic produce, organic berries with lots of colors, and make sure you're sleeping well. I have a lot of guys that are shift workers who really struggle with this. And to any shift workers listening to this, the best thing you can do, obviously, besides changing jobs or changing to a day shift, would be you've got to really live the nightlife. You've got to stay awake at night on your off days as well. Otherwise, you're just living in constant jet lag and your cells in your body and your hormones just can't keep up. And then I'd say to my 30-year-olds, my guys who are maybe looking at starting families, go see a naturopath, go see a functional medicine doctor and get worked up for the both of you and see what aspects in your life could be changed. Usually it's not very difficult stuff to change, but it can have a huge impact on not only your health, but your potential child's health as well. For my middle-aged to later guys, I would say don't be afraid to look into getting testosterone replacement. A lot of guys in their 40s, 50s are really starting to get into the lower end of testosterone. A lot of guys just deal with it, but don't be afraid to go and get tested and even get replaced. For the younger guys, it's a little bit harder of a question because testosterone will lower your fertility and make you infertile temporarily.
So I have a question that I really want
Yeah.
to ask. I think a lot
Yeah.
of times from the women's perspective, they say there's like a age cutoff by like a certain age that you shouldn't have kids. Do you agree or disagree that it's there a certain age for men as well?
Well, I mean, I think there's two facets to that question. Socially, I think a guy should be around for his children at least until they're mid 20s, ideally, in a helpful fatherly capacity. So I think that would probably bar my 80-year-old patients from having kids. But, if he's healthy and he thinks he's got a long, long life to live, I wouldn't recommend having kids past 45 for a guy. Again, it comes back to that health of the sperm issue because we're really starting to accumulate mutations past 40 for a guy. It's actually one mutation every 2 years on average. And I think for women, it's one mutation every 20, I want to say. So it's hardly anything for women. So while women are technically a geriatric pregnancy after I think age 35, women as high as 45, there's more complications at risk there, but they're generally on average going to have a healthier fetus with a younger father than an older father.
That's really good to know. I think that's always like a question in the air because it's like, men's hormonal health, men's fertility, it's not talked about enough. And just,
It's not. Yeah.
like myself, like That was always been a question because it's always on the women. It's like, "Oh, you reach a
Mhm.
certain age, you shouldn't have kids after this age, or you should have kids before you reach a certain age." But what about the men as well? So thank you for sharing
Right,
that.
right. Just because they can doesn't mean they should.
Exactly.
Put it that way. And don't be afraid to get a vasectomy. I wanna put that out there too.
We have lots of options in this world.
That's right. That's right.
Incredible. Well, thank you so much, Dr. Michael, for sharing all of your knowledge and
Of
all the
course.
tips with us. Where can people stay in touch with you and where can they come see you if they're local to the Phoenix area?
Yeah, so I do exclusively telemedicine, so I'm able to be reached online. You can see me on my social handles at Dr. Michael Morse on most platforms, and then I'm also on ND On Demand, which is a platform that I run if you want to see me as a patient. I'd be happy to assess. I see patients in Arizona for more medical issues and where I can prescribe, but I can also see clients outside of Arizona that where we can just do more lifestyle and diet counseling.
That's amazing. Thank you so much. And I'll have the links tagged below in the show notes so then people can stay in touch with you and stay up to date with you. Thank you for joining us today, Dr. Michael.
Thank you for having me. It's been wonderful.